This video is all about invasive tear breakup time test, commonly known as invasive TBUT or fluorescent TBUT. This is one of the most important clinical tests we perform to assess the tear film stability, and it is a key part of any dry eye assessment. In this video, we will cover what TBUT is and why we perform it, and the difference between invasive and non-invasive TBUT, and the step-by-step procedure for invasive TBUT, and how to interpret the results and the clinical significance of the findings. Whether you are an optometry student learning this for the first time or a clinician looking to refresh your technique, this video will give you everything you need. So let's begin. Tear breakup time, or a TBUT, is a clinical test that measures how long the tear film remains stable on the surface of the eye between blinks. After every blink, the tear film spread evenly across the cornea to maintain a smooth, clear and comfortable ocular surface. But this tear film does not stay forever. Over time, it begins to thin and break up, forming a dry spot on the cornea surface. The time it takes for these dry spots to appear after a complete blink is called the tear breakup time. A short tear breakup time means the tear film is unstable, which is a key sign of dry eye disease. There are two types of TBUT tests, invasive and non-invasive. Non-invasive TBUT measures the tear breakup time without adding anything to the eye. It uses instruments like stereoscope or topography-based systems to observe the natural tear film directly. Invasive TBUT involves instilling fluorescent dye into the eye before the measurement. The fluorescence stains the tear film, making it visible under the cobalt flow filter of the slit lamp, so we can clearly observe when and where the tear film breaks up. Invasive TBUT is the most widely used method in clinical practice because it's a simple, cost-effective and does not require any advanced equipments. Before we get into the procedure, let me list the equipments you need for invasive TBUT. First one, you need a fluorescent sodium strips or fluorescent drops. Strips are preferred because they deliver a more controlled and minimal amount of dye. Second one, you need a slit lamp biomicroscope with a cobalt flow filter. This is essential. Without the cobalt flow filter, the fluorescence is not visible. The final and the third one, you need a timer or a stopwatch. You need to measure the time precisely from the last blink to the first breakup. Now let us go through the complete step-by-step procedure for invasive TBUT. Step 1. Explain the procedure to the patient. Tell them you are going to place a small amount of orange colored dye in their eyes. It may feel slightly uncomfortable for a moment, and you will ask them to blink naturally and then keep their eyes open as long as comfortable. Step 2. Moisten the fluorescent strip with a single drop of sterile saline or a non-preserved artificial tears. Do not overwet the strip, as too much fluorescence can dilute the tear film and affect the results. Step 3. Ask the patient to look up and gently touch the moistened strip to the inferior palpebral conjunctiva, the inner surface of the lower lid. Avoid touching the cornea directly. Step 4. Ask the patient to blink 2 to 3 times naturally to distribute the fluorescence evenly across the cornea surface. Step 5. Position the patient at the slit lamp. Switch to cobalt flow filter. Use broad diffused illumination to weave the entire cornea surface at once. Step 6. Ask the patient to blink once completely and then keep their eyes open. Start your timer immediately after the last complete blink. Step 7. Observe the fluorescent tear film carefully under the cobalt flow filter. Watch for the appearance of dark spot or streak in the bright green fluorescent film. These are the dry spots where the tear film has broken up. Step 8. Stop the timer the moment you see the first dry spot appear. Record this time in seconds. This is your TBUT value. Step 9. Repeat the measurement 3 times and take the average. This gives a more reliable result as a single measurement can vary. Now let us talk about how to interpret your TBUT findings. A normal TBUT value is generally greater than 10 seconds. A TBUT between 7 and 10 is considered borderline and it should be monitored carefully, especially if your patient has a symptom of dry eye. A TBUT less than 7 seconds or in some guidelines less than 10 seconds is considered abnormal and it's a strong indicator of tear film instability and dry eye disease. The location of tear breakup pattern also gives us a clinical information. Central breakup, which means dry spot appearing in the center of the cornea, is often associated with evaporative dry eye or meibomian gland dysfunction. Peripheral breakup is generally less clinically significant. Immediate breakup, which means where the tear film breaks up within 1 or 2 seconds of blinking, which indicate severe tear film instability and should be investigated further. TBUT is not just a number, it's a window into the health of the entire ocular surface. A reduced TBUT is always associated with evaporative dry eye diseases, meibomian gland dysfunction, contact lens related dry eyes, blepharitis, and ocular surface disease following surgery. In clinical practice, TBUT is always combined with other tests for a complete dry eye assessment, including symptom questionnaires like OSDI, Schimmel's test for aqueous tear reduction, lid margin assessment, meibomian gland evaluation, and corneal and conjunctival staining. No single test alone diagnoses dry eye. TBUT is one important piece of the complete clinical picture. Before we finish, let me share some important clinical tips and common mistakes to avoid. Tip 1. Always use minimal fluorescent. Too much dye dilute the tear film and artificially prolong the TBUT, which gives you falsely normal result. Tip 2. Ask the patient to blink naturally, not forcefully. A forced blink can disturb the tear film and affect the measurement. Tip 3. Always take 3 measurements and average them. A single measurement is not reliable for clinical decision making. Tip 4. Do not instruct the patient to keep their eyes open for longer than is comfortable. This itself causes tear film disruption and will shorten your TBUT artificially. Common mistake: starting the timer before the complete blink. Always wait for the full blink to finish before starting your stopwatch. So that is the complete guide to invasive tear breakup time, the procedure, interpretation, clinical significance, and the tips you need for accurate, reliable results. TBUT is a simple test, but when we perform correctly, it gives us extremely valuable information about tear film health and dry eyes. If you have any questions about the procedure or interpretation, drop them in the comments below. I will answer everyone. And don't forget to like, share, and subscribe to iCare Optom. I'll see you in the next video.